Okay, everyone. So I'm here with Sharon Gamblin, and I'm really excited to be able to have her share her story and her experience doing physical therapy with us at PhysioLogic. Sharon, thanks for taking your time and being here and talking with us. So let's go back to the very beginning.
All right.
Okay, you first came to us probably a year
and 2 months ago.
July of 23.
Mm-hmm.
So tell me a little bit about what was going on, why you had to come to physical therapy, and why that started.
Actually, I had gone to a doctor, and he had advised me to immediately go to the hospital. He was going to do surgery on me within that week, put 2 bars down my back, bars all the way across my back. And when I asked him, could he guarantee me my hands and leg would not be numb any longer? He said, I can't even guarantee you're going to be alive. And I almost panicked. I walked out of his office, and on the way home, my daughter said, Mom, are you comfortable with this? And I said, no, I'm not. I said, I'm going to call when I get home and cancel the surgery out. I can't do this. I cannot run the chance of being in a wheelchair, not being able to have control of my body, and not functional. I'm not giving up. I was about to turn 80 years old. I called a friend of mine that was a doctor, and he said, let me send you to another doctor. The doctor looked at all the MRIs and the CTs and the x-rays, and he said, first off, because of your age, I wouldn't touch you with back surgery at all.
Wow.
And I said, I agree. I don't want to end up in a wheelchair. And at that particular point in time, I was on a cane, and at home I was on a walker. I'd already fallen once from my waist down. I would go numb. I fell, hit my head on the door facings, laid my head open in the back, had 6 staples. I attempted to walk around a football field after I watched my great-granddaughter's football game. She was a cheerleader. I just collapsed, which was extremely embarrassing. I then went to the doctor, and he told me he wouldn't do the surgery. And he said, what about physical therapy? I said, any physical therapy I've had in the past, I was not happy with. I said, who do you recommend? He said, there's a new one in Aledo. And I said, all right, I'll give it a try. I said, but normally I go and they show me what to do and they walk off and leave me, and I have no clue whether I'm doing it right or wrong. And most of the time I was probably doing it incorrect because no one was there to correct me.
At that point, you had been strongly recommended towards surgery. You had already taken a step in a direction that most people don't, which is getting another opinion.
Yes.
So that's a really smart thing to do. That's really good.
It's extremely important.
It's good to be as well informed about your specific situation. That's for any individual person that's going through anything. Looking over some of your imaging and some of your history, some of it looks really scary to a provider or to someone that's, dealing with it. And it sounds really scary too. So do you mind if I share some of that information?
No, I do not mind at all.
So in your back, there were some things that were going on at the lumbar level, L3, L4, L4, L5. Specifically, you had what's called anterolisthesis, and that's where the vertebral bodies shift on each other. And then you had something else, specifically at the L3, L4 level, they call it complete effacement of the spinal cord.
Yes.
And so with that shifting and with some disc bulging, what they call degenerative changes, you have compression of the spinal cord. When a doctor sees that, a surgeon, it can look really bad.
They panic.
They panic, and then that kind of goes into you, and then you're panicking. But you made the choice to get another opinion because of, you're kind of between a rock and a hard place. You're afraid because of what your back's going through, and you're afraid because surgery is a big undertaking.
And not only that, but I had other doctors saying, you sneeze, you're going to be paralyzed. And they told my daughter, take her home, sit her in a chair, do not let her get up, walk, or do anything unless someone's helping her. And I'm going, I'm fine. No, you're not. By that time, I was almost in sheer panic, but I'm a little hard-headed. I had tried all the shots, all of the pills, but what the pills do to you mentally is worse than the pain that's going on in your back and your hands and your leg. I was ready to try anything. Physical therapy, I was very, very skeptical about. And if you'll remember, when I walked in here, I was bent over. I was on a cane because I was too proud to walk in on the walker. That's a year and 2 months ago.
Tell me a little bit about how you felt and how you were restricted in your day-to-day.
They had stopped me from driving, cooking dinner, picking picking up, cleaning, anything. I'm still working at that time, full time, and I was driving 45 miles every day. And I'm thinking, my life's over. There was just no way. So the day I walked in here, I was petrified. I mean, I'm talking petrified, very skeptical of who was here, who I was going to meet. Then I picked up a card and it said, doctorly opinion. Then I saw that Phil was also had his degrees and that y'all had done more than just taking a physical therapy class where you help people work out.
Right.
There's more to your knowledge. Having had 2 knee replacements, I don't do physical therapy on that. Having had my neck operated on twice, the first time was 5 and 6. The last time they did surgery was 2, 3, 4, 5, and 6.
Wow, that's a lot.
Yeah, and I knew what it took to get over that, and I knew what it had taken to get over the knee replacements, which even built in more fear.
So at that time, you had been told that you could be paralyzed if you moved, if you sneezed, or if you moved incorrectly. You're in panic. You're afraid to move.
Yes.
And then the suggestion is, well, try physical therapy, which is move me, right?
Yes.
So that puts you in a kind of in a scary situation. How do you feel like therapy helped you get to a point where you could break through that fear?
When I came in and I met you, the more I talked to you, the more you evaluated me. That very day, I believe we were right here. And talking to you, you gave me enough confidence to walk back in this building because I really had no intentions of going through the therapy when I walked in that day. But when I came in and sat down and talked to you and you said, we're going to start with small steps. We're going to see what and where you can go. They were very small steps, which I appreciated because you gave me back the confidence. But you stood there beside me and said, let's try it again.
Yeah.
Let's do this. And as you took me by the hand, and every time I'd be, I don't know if I can do this. I don't know if I can do it. But you said, I'll see you on Tuesday. I'll see you on Wednesday or whatever.
Right.
I knew I didn't want to disappoint you.
Oh.
And I think that was a big part of giving me the encouragement and the ability to come back. When I left here yesterday for my physical therapy, I could have taken on the entire world. It didn't matter. That's how good I felt. But I know when I get home, I have to continue to do some of the simpler exercises that you've given me a list of that I can do at home.
Right. Consistency is key.
Yes, that I'm not going to put myself in jeopardy of falling. I could not show it. I had to keep pushing.
Right.
Because I have family. I have a great granddaughter. So I knew I had more to live for. And that was my whole goal is I have to get back on my feet. I have to.
You're highly motivated, as shows in your therapy sessions.
Yes.
And again, we have some footage of that we're going to show. So it's going to be showing kind of what you did. So if you can remember back a year and a couple months ago, do you remember what your goals were at that point?
Well, you helped me set the goals. The first goal was very simple, very small. And I met it fairly quick. But I think the reason I met it was because you never left my side. You made sure that everything I was doing was correctly. It was just to be able to not have to have the walker, to have the cane only. Then my second goal was to be able to walk from my car to my great-granddaughter's football game because she was cheering. At that time, she was 8 years old. Setting that goal, I just kept thinking, I've got to be able to do that. I cannot embarrass her or myself. I did that. My goal was not the cane, but to use the walker to get from my car to the stands. I did it.
Yeah.
And when I came back and told you, it was like, guess what I did? I met my goal.
I remember that.
Yes, and I came back and I think there were 7 games that year or 8. Every time I'd come in here, I'd be floating on a cloud. I did it.
That's right. That's right.
Each step of the way, you have given me goals and points to achieve, given me the encouragement and the ability to meet those goals. There were never goals that were so large that I was afraid to try. I'm doing what I want to do again. Now, there's days when the rain starts in and I kind of go, oh, where did that ache come from? But I'm still functional. I'm walking. I'm cooking. I'm able to go to different things. And I think one of the things I was most excited about, my family had a birthday party for me. My son, my grandson, and some really close friends actually danced with me.
Oh, wow. Were you in heels?
I was in heels.
Okay, all right, because that was a goal of yours.
Yes,
I
that
think
was
I
one of
remember
my goals. Right now, working with you, seeing the encouragement, Phil and all the other people that are here, I never walk in that all of them speak. It's kind of like cheers. They all know your name.
That's right. That's right.
And they're encouraging you.
Right. Yeah. We all kind of like to be a part of everyone's, or recognize everyone's journey, even if you're not Phil's patient specifically, but everybody kind of has an eye on.
Yeah.
Okay. Hey, I've seen your progress. I've seen what you, where you are.
And even the patients here, we all comment to each other.
Right.
That's encouragement normally you don't receive. The other places I have been, people do not stand beside you. They're not making sure you're doing it correct.
Mm-hmm.
They never say hi, bye. This is a special place. Each and every person that's in here, whether it's the physical therapist, the doctors, or who, encourage each other. The patients encourage each other. We feed off of each other. Had a lady the other day that said, your balance is great. And I looked at her and I said, it didn't used to be.
That's a big part of your therapy, is being in an environment that's supportive and feeling, motivated and encouraged to do what you have to do. So I love sharing your story, Sharon, because you are motivated. You're in a position that a lot of people, when you hear that option of you need surgery, people maybe just kind of cave to that immediately. And sometimes that's not always the case. Sometimes it is. It depends on the situation, right? Everybody's an individual, but I love sharing your story because you opted for, a more conservative route, and it's really worked for you.
It's working.
You feel like you have gotten your life back, and your progress has been remarkable. It's been great. And you did it without having to depend on no shots, no surgery.
Yes.
Before we wrap this up, what advice would you give to someone that may be considering physical therapy but unsure?
Don't be afraid. You are the best motivator for yourself. You have to look in deep and say, what do I want? Do I want to be sitting in a chair the rest of my life? Do I want people having to take care of me? Or do I want to continue to be the person that I was before this back set in? Get second opinions, get third opinions until you find somebody that will look at you and say, there is an option. And then get to PhysioLogical immediately. Because I have gone through many other therapies and never made the advancement that I have here. I've been here a year and 2 months. I'm back in a small hill. I mean, I could at least feel like I'm still a productive individual and a human. Don't believe everything you see on Facebook.
That's so true.
I give you full credit. I give you 100% credit.
It's 100. That's what I was going to comment on. Was it's always an individual circumstance, right? Your story is special to you, but it's still possible for other people that are dealing with something similar to see similar results. But I think participating and giving conservative methods a try is certainly worth it. If surgery isn't indicated, a physical therapist could be someone that helps you helps an individual kind of get to that. Right. We as providers sometimes underestimate the body's ability to adapt and to change to certain situations or diseases, you could say. Mm-hmm. So did we as physical therapists and you participating in physical therapy, did we change the tissues? Yeah, to a degree. Sure. But did we do the same thing that surgery could do? Probably not. But we helped the tissues be able to adapt to the situation they're in and be able to, help you get to a functional place where you can live your life and do what you need to do again.
What I think, I'm not a medical person, is the muscles and everything in my back begin to, I'll say, rebuild, and are holding all of that together right now and in my back. Now, I'm not crazy. I'm not going to pick up a 100-pound box, but from the day I came in here to this week in my physical therapy, I now can pick up more than a milk jug. I can also have my balance because you've taught me how to keep my balance. You've taught me what to do, how to do it. You forget. You forget how to not fall.
Mm-hmm. Especially after being impacted by fear and
fear. I mean, the fear was so set into me.
Right.
When I got to you, you begin to build up the strength in my legs. You begin to build up the strength in my body. And I think the most rewarding thing, you gave me back my confidence. I can do this. No, he's not going to do anything or have me do something that I'm going to end up in a wheelchair.
Right.
And that's major.
That's right.
That's-
Safety first,
Yes.
then teamwork.
Yep, I don't like the safety belt, but you had at me every time with that thing and
that's-
say, we have to have safety.
We got to stay safe. We got to stay
Yes.
safe. You know, our dosing it's challenging but attainable. And so pushing you to that next level. So that's great, Sharon. I really appreciate you taking the time to speak with us and kind of share your story. So thank you so much for your time.
Thank you.
And if you know of anyone that may be dealing with pain or mobility issues or undergoing surgical consult and just want to have another opinion or be evaluated, please reach out to us at PhysioLogic Physical Therapy and get scheduled for an evaluation.
This is the man.